Hi, my name is John Halstead. I'm the president and founder of Healthbridge Global. The Gospels record 34 distinct miracles of Jesus. He changed water into wine, fed large groups of people, and walked on water. 34 miracles. But 26 of those 34 miracles are what we call healthcare miracles, where Jesus alleviated pain, suffering, disease, ailments, and even death. That's 75% of the miraculous outflow of power from Jesus was spent touching people's physical bodies. That's why our mission is to connect the beauty of healthcare to the hope of the gospel. Now, you and I have a hard time picturing healthcare as a beautiful thing, but that's because we think of our healthcare system full of copays, deductibles, premiums, long waits, and short visits. But healthcare is not a system. Healthcare is one human being caring for another human being. And when that care is provided with love, dignity, and compassion, and especially when healthcare is provided in the name and character of Christ, that's when healthcare becomes a beautiful thing. And that's when healthcare can become a bridge for the gospel to closed nations, closed cultures, and closed hearts. And as God opens doors to partner on amazing projects around the world, we look for 4 really important things. First of all, every project must be initiated and led by a local leader. We don't come in and say, here's your problem and here's what you need to do about it. We come alongside our partners and ask, what problem has God called you to solve? And how can we help you do that? Second, we look for projects that will fill real healthcare gaps in the communities where these leaders are working. Third, we look for leaders and projects with an intentional and strategic plan to infuse the gospel into everything they do. This looks different in different contexts, but the common thread is gospel intentionality. Lastly, every project must be economically viable. They must be able to sustain their own operations. We want to help them take big visionary steps forward, but we don't pay their rent, salaries, and electric bills forever. This ensures that they will have a lasting healthcare and gospel impact for decades to come. Healthbridge Global has been honored to partner with so many amazing people and projects around the world. From building a pro-life women's clinic in urban Romania to mobile medical units in rural India. From refugee care at the Ukrainian border to a refugee clinic among Afghans in the United States. We've helped build pediatric units in North Africa and a mental health center in Eastern Europe. And we're currently involved in a women's hospital project in that region as well. Now, we help projects like those I just described in 4 main ways. First, we help build or renovate new clinics. Second, we help equip these clinics with equipment. Third, we coach our partners, combining our experience along with their local knowledge to make the biggest possible impact. Fourth, we connect with others because we don't have all the answers, but we can draw other partners into projects to bring their knowledge, skills, and gifts to bear. So, building, equipping, coaching, and connecting. That's what this all looks like. And with God's grace, we're just getting started. God has given us a bold vision. We call it our 20-10-10 vision. 20 gospel-focused healthcare projects in 10 nations in 10 years. And we're continuing to trust that through relationships and God's leading, the doors for the right projects and partners will continue to open and grow. I want to personally invite you along on this journey. Healthbridge Global, connecting the beauty of healthcare to the hope of the gospel.